Hey guys, I just wanted to react to this news that I just read about this company. It's called Inner Cosmos, and they're doing some interesting work. Um, I have some concerns. I'm going to talk about what they're doing, what I'm concerned about. It is pretty cool. Don't get me wrong, but you know, I have my suspicions that this might not work out as they're planning. But let me tell you more about this company and this article that I read in the news. So basically, they're this startup company that are trying to make these implantable devices, just like Elon Musk said he was going to make them, but his go all the way into the brain. There's this Inner Cosmos company. Theirs is supposed to stay on the skin, so it's not a very invasive procedure. So they're saying, they're quoting it, oh, it's a 30-minute outpatient procedure. And basically, it's this penny size disc that they place, that they call it the digital pill, that they place under the skin. And according to them, this can treat depression. So basically, I think what they're referring to, the general biology and physiology that they're referring to, is in terms of treating depression with some kind of electrical current. We used to use, ECT for treatment of depression, and that is kind of making a comeback now. Appears to be very effective. ECT is, or electrical stimulation of the brain, is very different than what they're proposing here in this company called Inner Cosmos. So they're saying some neurostimulation with mild current. This won't be like a true shock like ECT provides, which basically resets the brain and helps with depression. And in some studies has actually shown to help with depression more than even medication. But keep this in mind, that depression is a very complicated thing. It's not located to one structure of the brain or one chemical. We used to have this, or I guess in some fields, this understanding that depression is a neurotransmitter issue. It's oh, you don't have enough serotonin in your brain. So we put all these people on SSRIs or serotonin reuptake inhibitors. Now we're finding that it's not that simple. That depression is more than just a neurotransmitter issue. It's more than just a neuro uh, electrical issue. And I don't know, this company with these digital pills that they can place inside the skin, and then they're saying, oh, it will help you modulate your depression levels. They've just gotten 10 million in funding, crowdfunding. And I just don't want this to be the next scandal that unfolds. If it helps people, and I'm told, or I read that they are moving into human trials, and that's great. But I'm very concerned that this might not be what it is showing to be. Um, I don't think this can really fight depression like they're saying. So there was a group of scientists who kind of had a proof of concept using kind of a deep brain stimulation or neural stimulation with electricity. And it did work for one patient in California. And their stimulators were kind of like deep brain stimulators. Now, we do place those for people who have Parkinson's or epilepsy, but for those, we know the structures that they're going to affect. It's kind of like a limited area of the brain where we're trying to stimulate a structure or a cluster of neurons. We tend to know that really, we do that really well. I think depression is a little bit more different. It has a genetic component, it has an electrical component, it has a chemical component, it has overall kind of this nature nurture picture. It has so these people in California, when they did place um, this deep brain stimulator into the patient, they placed it, I would think, around the amygdala, and for them it worked. Remember, this is one patient, one woman who had untreated or treatment-resistant depression, and great, it worked for her. Reading from what I got, that's what I got, at least from their article in Nature Medicine. But uh, once again, this Inner Cosmos company is talking about a digital pill that stays on the top of your skin, and it's somehow supposed to stimulate your brain and fight and help fight depression. And if you listen to the CEO, Mr. Marin Gribetz, talk about it, it almost seems like he's talking nonsense, honestly. I would love to have either one of their psychiatrists, Dr. Darren Dougherty, I'm probably pronouncing that wrong. He's their chief psychiatrist or their chief medical officer, kind of explain the science behind it. And maybe they don't want to, maybe they don't want to reveal their data, their science, or how this is supposed to work, but it seems pretty far-fetched. Um, I don't see how patients can get active, real-time readouts of their depression levels based on one chip and using electrical currents of their brain. I don't think that's how depression works. Like I said, there's multiple avenues. Depression is a complicated disease, and I just don't want people to build hope for this company, and then they get a lot of money. People do really well, and then all of a sudden they realize, oh, it's not as what it's supposed to be. I mean, I'm saying that with a caveat. And I don't. I'm not a psychiatrist. I'm not an expert in ECT, which, as I mentioned before, does work. ECT is a real electrical therapy for depression, and for that we usually need to put the patient under, and you give them a certain amount of electrical dose. Either can be bidirectional, so it can involve both hemispheres, or it can be one unilateral. It can involve one hemisphere, but that has a long history. It's proven to work. Even that, actually, there are some components to it which are dependent on how much dose you give and what kind of patient it is. Not all patients will be affected equally, though overall, the data at least suggests that it does work better than antidepressants. And I know antidepressants aren't great; they have a whole bunch of side effects. And ECT has a whole bunch of side effects, and though it's becoming safer, it is probably not the safest thing. I know ketamine was big. There are ketamine clinics. There's research being done on using ketamine. I overall think that might be the safest approach, and a real full body approach using ketamine and other psychoactive drugs, particularly mushrooms, to have real cathartic experiences where a person can kind of come through by experiences on their own, whether they're hallucinations or whatever, to come to reality or in terms of their understanding of the world. I think that might be the best approach for treating depression because it will work on all levels. Um, so, to be honest, I can't even say we have a real grasp on one silver bullet to treat depression. I think it's a multiple uh, uh, avenue of treatment that will likely have a good end result. But it's not one thing that will work better than others. I think the way that we have set up right now is, physical therapy, or sorry, you go through therapy, psychiatric therapy. They try some antipsychotics or antidepressants on you, see how that works. You go through different ones and you do more therapy. If that doesn't work, we call it, treatment resistant depression or major depression syndrome. And then from there, you go on to, more kind of experimental medications like ECT and ketamine. And for some people, it works. And even for some people, it doesn't work. I think it has a success rate of about 75% resolution rate. But everybody's different, and depression is a very complicated thing. So the reason for the video is just, I don't know. I don't think this company is able to do everything that they're talking about. I hope it's not just a cash grab. I hope they have real research and real science behind them. It sounds really cool. It sounds really cool on paper, where you can, do all these things, and people can get instant relief by, on their phone, kind of making it into like an app, which will help treat your depression. It looks great on paper, and um, but I think it's one of those things that if it sounds too good to be true, it probably is not true. So I'm wishing them all the luck, Inner Cosmos. Maybe they can pull it off. Maybe they know something that mainstream science doesn't, or they have some form of breakthrough that's waiting to happen, or has happened, but they're waiting to share. It's all very exciting. You know, we'll see what their human trials look like. I'll be keeping a close eye. Interesting stuff, but like I said, I don't know. I think I need to see more information before I'm sold. And people who are giving them money, I'm wondering what they've shared with them. You know, for them to raise 10 million in crowdfunding, they must be doing something right. And I would love to see some of their research. Would love to kind of at least get a better idea of what is going on in terms of the science of it. I've heard their CEO explain it, and it kind of sounds like hocus pocus to me. But what do I know? I'm not a psychiatrist. Anyway, thanks for listening. Bye.